Hi, Dr. Dave here with Synergy Wellness in New York City. We have a patient here, and we've actually done a video on his condition before, and probably many of you haven't seen. So if you haven't seen it, be sure to check that out. It's another video on a hemilaminectomy. So that's a back surgery for those of you that don't know, and for some of you watching this video, you do know, you're fully aware of hemilaminectomy. So here's our spine, right? And this is looking from the top of the vertebra. And if you look here and you zoom in a little, you'll see here is the lamina. And then the lamina come together and form the spinous, which is that little bone that sticks out here in the back of our neck and our lower back, right? So what he had done was they came in and they cut out this part of the bone over here, one of the laminas. You have two, right? So they take one out based on where the herniation is to take pressure off of the nerve. Now it makes the back unstable, and a lot of times after 5 years the surgery is ineffective. Post-surgical pain, and it's common for most surgeries. I would say the least invasive surgery would be a discectomy. If you can get away with just doing a discectomy, great, but we save people from having to have a discectomy or a hemilaminectomy in the first place. But he's had the surgery, he's had this side of the lamina removed, and the other side is there and intact. Some people have both, and that creates even more instability and very difficult to have long-lasting relief from surgery. So how long ago did you have your surgery?
10 years.
So he had it 10 years ago, and we see him once a month, and you've been doing pretty well, wouldn't you say? Once a month it's been about a year now?
Yeah, no, it's gotten a lot better, for sure.
Yeah, so we see him once a month for checkups, and he's okay. He's sore when he comes in once a month. Once you have surgery, it changes things internally there in the spine. So not only is the spine more unstable, but you're much more prone to aggravating your back. So we see him once a month, and we can limit or mitigate those risks, him aggravating his back. So what I'm doing right now is cold laser therapy, and we had done several cold laser therapies in the beginning when he came to me a year ago in acute pain.
I rented it for a few weeks.
Yeah, you rented it for a week. Once a month is the safest bet for him. So this laser, actually, I can scan the back and check for inflammation and soft tissue damage, and it beeps to let me know, and then it tells me how long to treat the area. You notice how it beeped higher up his back. His surgery was way down here. The reason for that is muscle guarding. I don't know if you've heard that term, but muscle guarding is when the adjacent muscles next to the injured area tighten up. And it does that to try to prevent you from moving too much in a way that's going to aggravate your back. So it's a protective mechanism, but if you're muscle guarding for a long time, that can create more problems and make you more susceptible to re-aggravating it because everything is so tight and preventing you from moving past a certain range of motion where your back would hurt. Okay?
I definitely felt a little release.
You did?
Yeah, I went down my leg.
Okay. So he just said, for those of you that couldn't hear, that he felt a release. This laser is powerful. It really is. And you couple cold laser therapy with Cox flexion distraction technique, which is the technique we've been using on him for the past year. And it's a win-win. It really is. Hands down the best two therapies for any kind of post-surgical back or disc herniation or disc bulge or spinal stenosis. This is hands down the best combination of techniques. And you would want to do this before you go and get injections, nerve blocks, things like that, more invasive procedures. This is really non-invasive, the laser, obviously, as you can see in the flexion distraction technique you'll see in a minute. Very non-invasive and gentle and effective, most importantly, right? And Cox flexion distraction technique, hands down the best technique. Now, there are a lot of chiropractors with the table, but they're not certified. So just be careful of that. When you go to see somebody, there's a website to see if their certification is current. Mine isn't, but that doesn't mean anything, right? I don't need to take the same test and over again every year. He wants you to. The inventor of the technique makes money from that. But you just want somebody that has been certified in the last 10 years because the science has changed for this technique over the last 10 years. There hasn't been any breakthroughs recently, But you certainly want somebody that's been certified. It doesn't have to be up to date, but not just having the table, but being certified as well. So here's the release, right? And we've done this on the previous video that I went over on him. So, make sure you check that out if you're interested in this technique. And we've done a bunch of other videos on Cox flexion distraction technique. Hands down, gold standard technique, again, for post-surgical backs, discs, disc injuries, sciatica, pinched nerves, spondylolisthesis, all those different conditions. You doing okay?
Yeah, no, that's great.
Do you have any pain down the leg?
No.
Good.
So good. The back is releasing.
Good. So you can see here, folks, it's a very, very gentle motion, but it's powerful. And this can also be done on the neck if you've had surgery on your neck or had disc replacements or even a fusion in your cervical spine, your neck. And you can also hear my table's a little squeaky. We need a little WD-40. Okay. So folks, that is it. Now you see here when I bend his knees, this leg doesn't even go back even close to the right one. So that tells me his pelvis is off. So we're gonna correct that. And again, he had surgery. So a lot of chiropractors would put him on his side and have him bend the knee and twist. And no, you don't wanna do that with a disc injury. Most of the time it will work and it'll be effective. But for that small subset of people, and you don't wanna be that person, it won't work. It could make it worse, okay? So this is a technique called Thompson technique. So I use a bunch of different techniques just like other chiropractors do. And we're just gonna do a gentle technique here. Push this pelvis forward and this one back a little bit. So, and you'll watch when I do his leg check and I bend his legs, they'll be even. So for those, some people don't believe in leg checks, they work. They're very effective to assess the patient's misalignments in some cases, not always. Okay, now let's check. See if I can put my money where my mouth is. And look at that. I am pushing to the end, right?
Yeah.
Now this one actually, it's a little off. So this one, it's much better, but it's about, and this could go another inch to be even. So we're gonna just do one more adjustment here. Let's see if that corrected it. There we go. Okay, so that's it, folks. Hope you guys got something from this, and if you had back surgery, I hope you can get the right help. Thanks for tuning in. Thanks for smashing that thumbs up button, and of course, subscribe for new videos every week. Thank you.